A biopsy is a procedure that you will be assisting in with an oral surgeon. I do want you to know that a general dentist can also perform a biopsy, but oftentimes they will refer to an oral surgeon to have it done. And it's important, again, because you'll be assisting in this, you're going to have to get the appropriate instrumentation based on the type of biopsy that you're going to be doing. So you need to make sure that you have an understanding of the three different types and what they entail. So this biopsy here would be considered an incisional biopsy, and it's going to occur with lesions that are 1 centimeter or more. What they do is they remove a portion of the lesion along with some healthy tissue next to it. So as we can see in this lesion here, it's definitely more than 1 centimeter in diameter. It actually probably comes to about right here. And we can see that this punch biopsy here is not only getting part of the lesion, but it's also getting some healthy tissue as well. They need to make sure that they have something to compare it to. And I do want you to also know that it can either be done with a punch, or it can also be done with a scalpel blade where a portion of it is removed. And again, this is considered incisional. This one over here to the right would be considered excisional. And it's going to occur usually with lesions that are less than 1 centimeter in diameter. And what they do is they get the patient numb first, then they go ahead and they cut either with tissue scissors, they can take a blade, and they actually remove the entire lesion. And sometimes sutures are going to be necessary depending on where the lesion was removed from. But oftentimes you can get by without having to put a suture in, and patient will heal up just fine within about 7 to 10 days. I won't even notice that that was ever there. So this would be considered excisional. Then down here at the bottom we have the oral brush biopsy, also known as exfoliative biopsy. And what you do is it comes usually with a kit, and you basically scrape the brush over the lesion and try to grab some of those cells off of it, and you stick it into a vial. And then all of these, doesn't matter which one you're doing, is going to be sent off, and it's going to be read by a pathologist. Once the results are determined, they're going to let the office know, and then the results are going to be given to the patient. What they're trying to determine from these lesions is whether it's going to be malignant or benign.